I ask unanimous consent to be added as a co-sponsor to the Coburn Amendment number 2789, requiring all members of Congress to enroll in the new public health insurance option.
Republican Senators Tom Coburn and David Vitter apparently thought they could really embarrass Senate Democrats today by introducing an amendment that would force all senators and members of Congress to get their own health care through the public option. The public health insurance option some Democrats want Americans to have as a competitive alternative to private insurance. Senators Coburn and Vitter thought it would be super embarrassing for Democrats if they were forced to admit that even though they're fighting for Americans to have a public option for health insurance, they themselves actually wouldn't really want to be part of that type of plan. Sherrod Brown today called their bluff when he and other Democrats jumped at the chance to agree to Coburn and Vitter's amendment. Oregon Congressman Earl Blumenauer going even one step further in the House, announcing that he'll introduce legislation that would prohibit all members of Congress from receiving any government-sponsored health coverage at all until health reform passes. So no Medicare, no veterans care, no attention from the attending physician on Capitol Hill, no taxpayer-subsidized federal employee health benefits program like all members of Congress currently enjoy. They can all just wade into the private health insurance system and buy it for themselves, or try to get on their spouse's plan if they can, until the country gets reform.
A lot of these members of the United States Senate are already on Medicare. They already have the public option. We have, as you said, nice choices. We have like a government exchange already in the Federal Employees Health Benefit Plan, and that's what these Republicans are trying to deny the American people.
Melissa, I see you nodding along. I wanted to ask you, do you feel like the range of options that are still being considered in what's alive in the House and Senate are a reasonable approximation of the options in health reform? Or do you feel like what do you feel like about what it is that we're still considering?
Yeah, I don't think you really want to ask me what do I feel about it. But because I'll say, one of the things that I find obscene about the entire conversation is people who are experiencing health care that I am in part paying for as a taxpayer, who are judging and adjudicating and debating whether or not, my sister or my cousin or my mother or my daughter can have health care. There's just such a level of dishonesty that is involved with that notion that people who are going to pay premiums into the public option, right? This is not, despite what Senator Lieberman says, a single payer system by any stretch of the imagination, right? It's premiums that people will pay. But I pay taxes that help pay for the health insurance and health care of these individuals who are debating this as though they are not already sort of living on the dole. So I'm really a big fan of all of them losing their coverage while they make these decisions.
Nick, the Blumenauer bill would make a lot of sense to me if, at the end of health reform, we were all going to be able to buy into that federal program.
It would sure be satisfying, isn't it? Right. Or at least there are 17% of Americans who are uncovered, and maybe another 10% who are underinsured. At least if one could see 27% lose their health insurance until this was resolved. Yeah. But in regard to the point that you both made, it is striking. The irony is that the two parts of America's healthcare system that are most popular and that work best are precisely the single-payer parts, the Medicare and the Veterans Program.
What about the sort of what's the matter with Kansas problem here? Nationally, the worst states for people being uninsured and underinsured are the states where represented by members of Congress who are most opposed to reform. The reddest states have the worst health care situation right now. How does that resolve in the long run politically?
Well, I think part of it is we've done a terrible job on my team of messaging all of this. We should have started with a conversation about Medicare, how we got there, the fact that a lot of the same opposition came at the time when we added a security for those over 65. But we've also got to do something else. We have this exaggerated sense among Democrats that our moderates somehow are going to ensure their reelection by running away from health insurance. Right. The reason they got elected in those districts is because they talked about health care. As our party said, we're going to try to fix these problems. I don't buy the idea that these blue dogs, these conservatives, that are increasing their chance of getting reelected by not fixing health care. It's going to turn out to be just the opposite. If the president wants to help this case, and I think to some degree, as I've said to you before, if he would put his finger on the scale on a couple of these issues, we would probably be done by now. Yeah. But he wants to kind of let this thing tussle for a while, and I think what we're going to find is this is getting watered down to a place that I'm not sure. I mean, it's going to be valuable, but it is sure not going to be as good as it could be.
And that actually may affect the political dynamic that you're talking about, because if we go through all of this political rigmarole to pass something that doesn't have much of an effect on people's lives, or really ends up being a disappointment, or worse, makes things slightly worse for some people who already have health insurance, I don't think that's going to happen. But if the immediate impact doesn't feel good to the American people, essentially, I think people could be hurt for having voted for it because of all the Republican caricatured attacks on it.
But I mean, let's be clear, this notion of the kind of what's the matter with Kansas assumes that people are responding primarily to a framing that is really about the policy. And it's clear that these, both blue dog Democrats as well as the deeply, deeply red senators and members of Congress are playing a political game. And the game is simply massive resistance to Barack Obama, massive resistance to the Obama administration and to anything that it suggests, particularly if anything that it suggests has nuance, complication, that it addresses sort of complicated, broad political matters. It is so much easier to just say, no, that's big government, than to address the sort of core problems. And all of that is driven by these issues of sort of the initial anxiety that exists in our country around both race and class. And by class, I mean here sort of our shrinking economic pie that often causes a kind of ethnic balkanization, people pulling to their own sides and saying, we can't possibly do for one another because our pie is shrinking. So remember that these red states are often very poor states. If you think about Louisiana, for example, states with high levels of unemployment, and people feeling as though any sort of attempt to help others comes at their own expense. And just a failure to talk about how, in fact, these are exactly the kinds of expansions that would help unemployed workers in places like Louisiana.
And haven't we made the wrong argument? I mean, let me throw this out, that it strikes me that in other countries like Switzerland that have adopted a more universal health coverage, the winning argument there has been a moral one, has been that people should not die because they can't get insurance. And instead, this year with Obama and in '93 with Clinton, the arguments, I think, tended to be more technical, more about cost saving, more sort of policy wonkish ones. And I wonder if that, in a sense, people in Kansas, if we don't lose sight of this basic question that, 45,000 Americans die a year because prematurely.
That's interesting. But if we think that, if we water this down far enough, we get 218 votes in the House and 51 votes or 60 votes in the Senate, okay, we'll come back in a couple of years and do it. No, if we don't contain cost, this is going to be a failure.